mang cái áo đi mà cho anh, mình không mang đi.
It is my great honor to be here in front of you, and I appreciate our committees because I'm so happy in this weekend because I love the Bgen food. So I enjoy the po and punja and banh mi every day. It's good to me. Today's my topic is the interdisciplinary treatment with the SERAFIN clear alignment system. Actually, I am the prosthodontist, and then I'm teaching in the 3 dental school in Korea. Also, I do a private practice, and then in academic activity. So I am the past president of Korean Academy of Aesthetic Dentistry, and now I'm a vice president of CHUYêN Academy of Aesthetic Dentistry. Also, there's the International Federation of Aesthetic Dentistry, like the WHO. I'm a president-elect. Actually, next year in November in Seoul, we have the World Congress in the aesthetic dentistry. So at the time, we talk about the orthodontics and prosthodontics, implant, everything about the aesthetic and the functional. And also, you don't need to worry about the language because now it's the AI. So next year, so we translate automatically all around the language. So you can just come to the Korea and enjoy the Korean food and Korean culture, and then enjoy the lectures. My topic is today's my focus is interdisciplinary orthodontic treatment. I'm a prosthodontist, so this presentation is a prosthodontist view. And then also I talk about the SERAFIN clear alignment system. It's like the Invisalign. It's a Korean system, and now so you can use in Vietnam too. So I'm gonna share some cases. What is the interdisciplinary dental treatment? This one involves a collaboratory approach where different dental specialists work together to address complex oral health tissues. Complex oral health tissues. What is the complex oral health tissue? The patient has some collapsed occlusion, or patient has unfavorable occlusion. What is the collapsed occlusion? Previously, the patient has a normal occlusion, optimal occlusion, good occlusion, and then that condition is a stable and functional bite and stable joint, and then minimal the muscle strain, and then proper anterior guidance. And then with aging or something happens, the perio problem or parafunctional habit or tooth loss or the migration of tooth, and the result, the patient has collapsed occlusion. Usually patient has a severe worn-out dentition and decreased the vertical dimension of occlusion. So like this patient, he is 75 years old, he look good but very deep bite, and then his all tooth is worn out. It's a decreased VDO, and then his bite is okay. Yeah, this kind of the condition is the collapsed occlusion. How about unfavorable occlusion? Unfavorable occlusion means the patient has a pathogenic occlusion. What is pathogenic occlusion? The pathogenic occlusion is the definition is like that. An occlusal relationship is capable of producing pathologic changes in stomatogenic system. It's not a pathologic occlusion. Pathologic occlusion is a result. Previously, the patient has that condition, something happened to pathologic occlusion, is capable of the pathologic changes. So pathologic occlusion is patient has a class 2 or class 1 occlusion, and then COMI discrepancy. Its old term is a COCR discrepancy, but now as an official term is a COMI discrepancy. And then also patient has a no anterior guidance, it's not good condition. So that result, the patient is very complex, the problem is the occlusal plane is tilted or asymmetric face or tooth loss or unfavorable occlusion, or patient is the big PMD problem, like this patient. This patient has the upper tooth is aligned well, but there's the occlusal plane is tilted, like that. And then even she had the orthodontic treatment before, now the occlusion is not good. She has the class 2 occlusion and then big overjet and open bite, you know. And then she has the congenital missing of some tooth. Oh, sorry. Yeah, she missing the canine, upper left canine and lower left canine and one premolar, like that. So previous doctors tried his best, but he didn't finish the properly. So now she has a class 2 open bite, very big problem is that she has a TMD, so all the time. How do you treat this patient? We need a treatment goal. You know, technique is not the issue. The treatment goal is very important. So what is the goal of orthodontic treatment? It's a normal occlusion. Dr. Edward Engel said the establishment of a normal occlusion of the teeth should be the highest aim of the orthodontist. It's right. But the normal occlusion means the class 1 occlusion. It's a definition. It's something the patient has the crowding and rotation. It doesn't matter. The first molar relation is very important because why? First molar relation is good. This is his drawing in 1900. Is in his book. His meaning is a normal occlusion. It's a functional occlusion because his teacher is Dr. Vao-Wioc said the patient has a good occlusion is it's a normal set of the perfect type. So the patient has a good normal occlusion, it stays all the time, no problem anymore. So anyways, the normal occlusion means the functional occlusion. So what is the functional occlusion? Functional occlusion is the definition is very simple. The contact of the maxillary and mandibular teeth during mastication and deglution. There's no about the TM joint and muscle, only bite. Because patient has just a good bite in upper and lower tooth, we can eat the food, we can swallow it, and then we have the respiration, we do a deglutition, we can do everything. However, the prosthodontics is different. The definition of the prosthodontics is like that. The prosthodontics is the dental specialty pertaining to the diagnosis, treatment planning, and rehabilitation and maintenance of the oral function, comfort, appearance, and the health of the patient. So the goal of the prosthodontic treatment is the functional occlusal harmony. The functional occlusal harmony, the definition is like that. The occlusal relationship of opposing teeth in all functional ranges and movement that will provide the greatest masticatory efficiency without causing undue strain or trauma on the supporting tissue. What is the supporting tissue? The perio and muscle and TM joint. So the prosthodontic, the goal is the rehabilitation. We treat everything, all the maxillofacial area. As you know, the Dr. Ross published his series, the papers, the 4 papers in JCO. In his the paper name is the Functional Occlusion for the Orthodontist. In his paper, he said the treatment goal of orthodontics is like that: pleasing aesthetic, facial aesthetic, and then molar key is a class 1, and functional occlusion evaluated neurologically on the articulator, and then stability of the tooth position and alignment, and comfort, the muscle and TM joint. But he follows a neurology concept. He follows this concept. This concept is bioaesthetic dentistry, but this one is not the original neurology. Dr. Robert Lee is a modification and a neurology concept, but why he insists this one? Because patient has a good GR position and then canine guidance, patient tooth doesn't wear. He believed like that. So Dr. Lowe said, at the time, usually young patients do orthodontic treatment. So if young patient has a good occlusion, like the neurology concept, his permanent tooth is all the way is the healthy and stable, we believe. But anyway, I'm not the law school, but I agree to his concept. So goal of excellent functional occlusion would be met by achieving Andrew's 6 key, right? And along with the seated condyle position. Seated condyle position means a CR position, stable CR position, and patient should have the mutually protected occlusion. But it's not easy. So now, actually, the bracket system and clear aligner system is very developed. You know, you can use very simple efficiency. You can finish very, you know, easily the treatment. The bracket is like that. The patient is a 35 years old man. He has class 2 and the retrognathing mandible, and the very protrusive the tooth. And then panoramic X-ray, TM joint is okay, but he has a very long face, and then panoramic X-ray is not good. And then very severe class 2, open by, you know, and then he has A and B is 9 degrees, and severe class 2. How do we treat this patient? Actually, his previous dentist recommended tujo surgery, but nowadays we can treat without surgery this kind of cases. I have some braces, his extraction cases. The level aligning is almost the finish up. I finished up this patient in 19 months. Everything's fine, and then now it's a good occlusion. But still, he has the little connecting mandible. So I, you know, suggest the genioplastic surgery. So after treatment, his face like that, and follow up. His face is changing, and his occlusion is changing. You know, it looks very difficult, but current occlusion the orthodontic treatment is you can provide very, you know, you can finish very easily and simply. The before and after, and then follow the face. Face is a totally different change. How about the clear aligner system? Clear aligner is the same. You can treat every kind of cases. She is a 58 years old dentist. She is almost same. It's open by the class 2. He like that. Also, we treat it's a clear aligner system, the SERAFIN, because she is a dentist. He is a user of this system. He treats by herself. 10 months. Occlusion is getting better. He has a refinement. And then 13 months. Now he has a good anterior guidance. He doesn't have a TMD anymore. And then space closing. And then 25 months is almost finished up. So now she has the final staging. It's almost finished 27 or 28 months. So even the extraction case, you know, the clear aligner system can use, you know, like that. It's not sometimes the dentist said the clear aligner system is using the simple cases. Now it's no. You can treat any kind of cases almost the same time as compared to the bracket system. So now, why we need the collaborative approach? Because nowadays some patients very old, some missing tooth, and the patients need the crown and then the implant. So needs for the prosthetic treatment, and then every dentist is different skill and experience. Orthodontist doesn't work with brace implant, and the prosthetist doesn't work with the braces. And then they have a different treatment goal. The doctors has different goal, and the patient has different goal. How about this patient? This patient, you know, she needs the braces, but she also needs the implant or the prosthetic treatment. So that's why in this kind of case, it's increasing now. So we need corroborated treatment. So we do corroborated treatment. What are key principles for a more harmonious occlusion and beautiful face? This is 5 factors we have. It's very important. The patient has the stable CR position, the stable joint, and the patient has the good occlusion. What is the good occlusion? Patient has a mutually protected articulation, and patient has vertical dimension of occlusion is optimally, and then anterior teeth is important, and also the muscle important. So in these 5 factors, the centric occlusion and occlusion scheme is about the function, and then the vertical dimension of occlusion, and then anterior teeth aesthetic is like the aesthetic. So you can treat your old patient, make the good occlusion like that. So you have to make the good lateral lining and 6 key, and then condyle position is seated the CR position, and patient should have a mutually protected articulation. Also, you have to check the vertical dimension of occlusion. The previously, vertical dimension of occlusion change is very difficult, but now we have a mini screw. So we can use a decreased video, and then you can increase video, you can do it. And also anterior teeth is very important for the smile line and then articulation. So you have to check the function like that, and then the aesthetically you have to check the video and anterior teeth. Actually, I have 2 books, but unfortunately it's not the English version. So the later so you can use in English book like that. So anyway, so every time we see our patient, you have to practice observing occlusion. Not only the tooth position, you have to check the patient occlusion. Patient has a mutually protected occlusion or not. It's very important thing. And also you have a practice observing the patient face. Everyone changes good face, right? So even patient has extraction some tooth, the face is much beautiful, prettier. Patient wanted. The patient, why we focused on the occlusion? Because the patient has not good occlusions, like the impaired occlusion relationship. The result, the patient has asymmetry and muscular imbalance of the face. And then the patient has in the mouth area the tension on upwardness, and then unnatural or forced smile. And then patient has not good the posture, and then strained facial expression. Take a look at this patient. This patient is a 35 or 36 years old dentist. She visits in my office because now she treats everything. Why? Because she has very protrusion. The tooth level is okay, but smiling is not bad. But she doesn't like the protrusive face, very protrusive face, like that. And then also she has asymmetry, right? Protrusive anterior teeth, and then also she has open bite. Open bite means there's no anterior guidance. And the smile line is not too good. And then severe overjet. No anterior guidance right there. She has class 1 right side, and then class 2 left side. And then also she has the condyle is not stable, so COMI discrepancy. Actually, habitual occlusion, she also has a big overjet. In CR position, overjet is bigger. So she has a very severe TMD all the time. So now she has some endodontic treatment and crown. Now she has a pain on the number 4, number 7 on the lower right, the second molar. So now she tried to the endodontic treatment, but now she's the dentist. She knows the occlusion is not good, so she went to the orthodontic treatment. And then anterior teeth, the root is very short, very protrusive, And then face is very long face. It's a low facial height, very increased. And then asymmetric face, like that. And also she has a class 2. The A and B is more the 7 millimeter, very high angle. So FMA is 35. And then she has everything is a problem. Condyle posture is not good, occlusal scheme is not good, vertical dimension is not good, anterior is not good, muscle is not good. We have solved everything. So her second premolar is not good. Already she has a crown, so I extracted the second premolar. So lamellar lining, and then I did the space closing. So now she has the anterior guidance. Her TMD is gone, but the patient, the pain is gone. Now she look for the aesthetic. Actually, when I start orthodontic treatment, I cannot change the asymmetric because occlusal plane is very tilted. The face is symmetric, so you need the surgery. But she doesn't want the surgery, so I do just make the good occlusion. But now she doesn't have any problem, and then the face is a little bit changing. Now she wants to correct the occlusal plane, like that. So how can you do? It's very easy, Now so we can place some mini screw and then intrusion in the upper teeth, and then retraction of the left side. So now she is a COMI constant and proper overjet. And then occlusal plane is changing. So I finished it like this way. So now profile is getting much better. And then I reduced the low facial height. So now it's the mid facial height and low facial height. It's almost the same ratio. And then the number 47. She has a good anterior guidance, the tooth is good. She doesn't have any pain on the molar. And then unwriting the upper incisor. And smile line is improved. And then the face is now it's much better in the symmetric. Improve the facial appearance. We can change everything, right? So it's a 2 years follow-up. Now so she is open its clinic, her clinic in another city, but she's not come anymore. But anyway, now it's almost an 8 year. She's good. So we have to know dentist. Dentist, is a true architect of the facial aesthetic and function. The patient saying the plastic surgeon is good to change the facial aesthetic. I don't believe. The plastic surgeon just only cosmetic, just change a little bit better, But orthodontists change everything, right? Smile and appearance and the function and health, everything. So I think if our treatment goal is face-driven functional occlusal harmony, this is the ultimate treatment only dentists can provide. It's very important. So face-driven functional occlusal harmony can be achieved by what? Interdisciplinary dental treatment. So why the interdisciplinary dental treatment is important? Because not only the doctors, the patient's quality of life is very improved. The change her life, change his life. You can change the patient's life. So when you do orthodontic treatment for the interdisciplinary dental treatment, we have to achieve the post-prosthodontic goal because the patient has the paleo is not good, patient needs the crown, patient needs the implant. How do you treat your patient? Because you do a treatment, the goal of a prosthodontic view is very important. So you have to treat your patient, the COMI, the constant, and then occlusal planes you have to change it. And then you have to change the vertical, proper vertical dimension occlusion, and then you have to make the proper anterior guidance. The proper anterior guidance is very, very important things. And then optimal occlusion is also good, need. And then you have to change the harmonious occlusion. So you have to achieve everything if you treat the interdisciplinary treatment. So why in Korea we developed the SERAFIN clear aligner system? Because the goal of SERAFIN clear aligner system is a harmony of the stomatocognitive system by interdisciplinary treatment. So in Korea, doctors ask the SERAFIN user, what is different in Invisalign? Actually the same. The clean check is almost the same, attachment, and then the sheet, the forming, everything is almost the same. But the different thing is the treatment goal. Our goal is the face-driven functional occlusion harmony. So we believe if you treat the SERAFIN clear aligner after treatment, overall improvement interdisciplinary treatment, because when you do treatment planning, we check everything, the CR position, and then usually the occlusion scheme, and video, and anterior teeth relationship, everything. So the clear aligner system, as you know, we have the side, the benefit to what? The oral hygiene control is good. Actually now in Korea, more than 40, 50 years old patient as orthodontic treatment. Even my father is 86 years old. He started the orthodontic treatment. The mind is changing. And then if you wear the clear aligner system, it's protection of parafunctional habit like clenching or the brushing. And then also the patient need ortho treatment and prosthodontic treatment in the implant surgery. You can do a continuously your treatment procedure. So when you put the braces, you don't know about the final occlusion. But the clear aligner system, as you know, the clean check or therapy, you can see the from start to final. So meantime, during the treatment, you can change your treatment procedure and treatment goal. It's very, have the benefit. The clear aligner system is very good, but when you start the treatment, you can see the end in your mind. So ortho prosto combined treatment, we can divide 3 types of treatment. Pre-prosthodontic orthodontic treatment, and the second one is orthodontic treatment as an alternative, or final one, very complicated and extensive treatment. Let's take a look, the first one. Actually, he's a 30 years old man. He came to my office. The smile line is not good. And then profile, it's okay, but a little bit protrusive like that. And then he has a spacing. And then also he missing the one of lower incisor. He want to the laminate me. Because why? Because he has a space in there. So I told him, you don't need the laminate because actually I can do the laminate. It's not good for you because the tooth, upper tooth is already square. If I make the laminate, the tooth is more square. It's not aesthetic. And also, how can I make the close the space with the prosthodontic, the crowns? It's not good. She has to make the space and then place implant. So you need braces. But he said, I don't want braces because he's a kickboxer. So I don't want to have the bracket. I worry about something that happens when I do kickboxing. So I told him, don't worry about it. Now we have a clear aligner, but patient doesn't know about clear aligner. But I explained, and then he accepted the treatment. So actually, when you make the space, number 41 is much easier to make the space because the clear aligner system already push the tooth. We can make the space here, this tooth move like that, and then you can finish very easily the patient treatment. However, now we do the convexity. When you see the convexity in number 41 space, where the bone is the vocal lingual bone is very thin, and then 42 area, this bone is much better. So I can place the place implant without the bone graft. a little protrusive. Actually, the class 1, a little bit high angle, the other things is okay. So he has a CR position is so good. Only problem is occlusal skin and then anterior teeth ascending. So we do the clear aligner system because when you clear aligner system, the tooth move the three-dimensionally. The medial-distally and anterior-posteriorly, the tooth move at the same time. So we can make the space and then also tooth move the back, and then we can make the overjet, and then upper tooth is the closed space and move back. The patient wear the aligner, and then only 7 months he wears 28 aligners. Everything's fine. The upper space closed. I make the space a little bit here, and then everything's fine. So I took the panoramic X-ray. The problem is a little bit axis, right? Because I didn't put the attachment on the front teeth a little bit, So I can place implant, but it's not good. So I do another refinement. The patient wear the 16 aligns more, and then now its axis is also good. So I, make the surgical guide and then place implant. And then 2 months after, I do impression with the internal scanner, the scan body, and then I make the custom abutment and then the provisional crown without the impression, so modelist crown. It's almost done. And then I finish up the treatment with the final zirconia crown like that. I finish it like that. And then before and after, the patient, the smile line is much getting better, and then protrusion is decreased, and the patient has the good occlusal skin. So now everything is fine. How about this patient? This patient is a deep eye patient. She says, I've had implant surgery and now I try to get orthodontic treatment. She's the freshman of the college student in USA. She has congenital missing of a lower second premolar. She has a primary teeth there, and then she said 3 months ago a tooth is gone out, the take off, and then she come to the Korea. He visited the dental clinic, but she lives in the USA. The dental dentist just the place implant. After place implant, she said her mom, I want braces because she doesn't like it's a deep eye and also very class too. But it's not easy because because of the implant, we cannot move tooth anterior posteriorly in the lower tooth. We have the only chance to move the upper teeth, right? And then she is not in Korea. She away to the USA. She comes back every year, 1 month. So we have no choice. We have to treat the SERAFIN clear aligner system because I give every aligner to patient. As you know, very deep bite. So I did the intrusion, the upper anterior teeth and lower anterior teeth, and move back and the upper teeth like that. Because I have to, forward movement because of a lower implant. So I'm gonna change the occlusal plane, and then I'm gonna change the proper anterior guidance. I'm gonna make the optimal occlusion, and then I'm gonna prepare, maintain of the crown space. She has a good CR position. It's okay, but occlusal skin is not good, and the vertical dimension is okay. Anterior teeth is not good. The muscle is okay. So I focus on what? Is the curve speed. The lower curve is very severe. So I make the treatment plan like the lower molar is not moved. The upper molar is a sequential distalization. And then I make the space. And the lower anterior teeth is going down. So make the flat occlusal plane. And the upper tooth is incisor, it's an intrusion. Also I do IPR. So I give a first aligner. But anyway, if she has a temporary implant crown, it's much easier to the clear aligner because implant crown is kind of anchorage. They don't move. They can push the other teeth. It's good. So I asked his previous doctor make the crown. So he make the abutment and then the temporary crown. I do another treatment planning, almost the same as before. And then she comes back 1 year after. She wear the 49 aligner. So bite is getting better. Class 2 is left side much better, the right side a little bit. So I do a second refinement. Now it's a 33 aligner. She comes back next year and then only she wears 30 aligner. Now it's okay, almost good. Occlusal plane is much better, getting better. And then right side and left side in the molar position is class 1. Intrusion is really good. So now she wear another 1 year, only 14 aligners. Now she finish her like that. Actually, she wear the custom abutment. Abutment is like the tooth in the clear aligner. We can use this abutment as a temporary crown as an anchorage. So I finish up like that. How about this patient? This patient also live in USA. Every year she comes to Korea the 1 year, like the vacation. But now, why she visit my office? Actually, she is a H2H bite, but molar relationship is class 1. The anterior teeth relationship is not good. Why? Because Bolton ratio is not good. So that's why upper is good, but lower is crowding, and then H2H bite. If patient has H2H bite, there is no anterior guidance, patient has a problem in the posterior teeth. So now she has the implant surgery, but this implant is not good, and then these two molar teeth is not good. She wants to extract these tooth and then place implant, but I can't because her anterior teeth relationship is not good. If this anterior relationship, if I place implant, the result is like that. The implant should be failed. So I asked her, do you need the braces first? So she is in CR position, CR position is open back. So when I do treatment plan with that, she now is a 26 aligner. So I give first aligner or 26 aligner. She came back to the USA, and 7 months after she comes back to Korea. 6 months after, because in the Bolton ratio, I expected 1 row incisor. Now she has a 3 incisor. So now what? There's a good proper overjet, and the smile line is much getting better. And then molar relationship is not good. And then extraction area is okay. So everything is condition is good. So now I place 2 implants, and then 2 weeks after I scan the abutment and crown. So I finish only 3 weeks. But now everything is fine because she has a good occlusal scheme. So now this 2 implant is, I think, is healthier for a long time. And then next year she comes back and then place implant, the right side. And then unwriting tooth is good. And then smile line is much getting better. And then face and smile line is good. But facial profile is not doesn't change, but a little bit change. But most the condition is much better, harmonious. Now, sometimes we do orthodontic treatment. After that, the patient doesn't need the crown or implant, like this way. He is a 75 years old man. She is a very deep bite. And then his previous doctor referred to me because full mouth rehabilitation because his dentition is, everything is worn out. But I told him, you don't need the full mouth rehabilitation because now it's okay, but only The problem is the broken a little bit crown. You can make the crown like that. You have 75 years. If you want to do a treatment, you need the braces. However, braces is not comfortable for your age, so you don't need to do anything, just stay like that, something happened, I make the crown. But patient, the 2 weeks after come back, even I'm 75 years, I don't want to do the braces because I want to make the good occlusion. It's okay. But as you know, it's a very deep bite. In deep bite cases, it's very difficult to place the braces lower inside tooth. So I recommend him the clear aligner system. The first aligner, and then only 7 months. Intrusion is not difficult in clear aligner, so only 7 months, almost done. So the CeraVe Clean Check is a 40th aligner. It's a rear tooth. It's almost the same. He wear the aligner very well. So patient compliance is very important. As you know, the clear aligner system, the tooth movement is almost the same. The treatment plan. So actually, he can finish less than 10 months. But he said, I paid a lot of money. Only 1 year, I don't want to finish. So he wear the more 17-month treatment. So now everything is fine. Even though I doesn't make the crown, patient doesn't have any pain. Now it's 2 years after, almost 3 years, he doesn't have any treatment. But actually, I recommend him only this one and this one. You need some crown. The patient is okay. But with the clear aligner system, the patient doesn't need the full mouth rehabilitation. Only orthodontic treatment, everything is finished. How about this patient? He has a TMD, and then now she has a severe pain on the tooth. A little bit protrusive, open bite, COMI discrepancy too, and then she has a severe pain on 16 and 37. The previous doctor extraction these tooth and the place implant, but now she has a TMD. She worried about the place implant. So I recommend her to make the treatment, orthodontic treatment, because she needs to make the good occlusion first. She has everything is a problem. So actually she has number 18. So my treatment plan is I extract the 16 and then move second molar as 4, and then the third molar is moved to the second molar. This first aligner, I deliver the aligner, and then 39 aligner, only 7 months. Now she has anterior guidance, and then second molar is a move forward. It's good. A little bit tilted. It's okay. But third molar is move erupt a little bit. Anterior guidance she has achieved. It's good. Now she doesn't have a TMD. And then 23rd month, everything is fine. The second molar is moved forward, and then third molar is moved here. So I finish up only 27 months, and then her bite is everything is good, smile line is good. She doesn't need the implant, right? I move the tooth and then I just make the crown. There's no interference. She doesn't have any pain. The medial side, the bone is in the making. It's good. The final one, very complicated and extensive treatment. This patient is class 2 and a congenital missing. I show you the people. Class 2. Tilted occlusal plane, and severe overjet, and then congenital missing 23rd and 33, 35. She has already fixed retainer. Occlusal plane is very tilted like that. Class 2 and severe open bite. How do you treat this patient? I do SERAFIN clear aligner system because she has a TMD. To wear the aligner, very good for the muscle, like the spring. So I move back the upper tooth. I move back the upper tooth, make the class 1, and the lower tooth in the left side move forward because I want to make the one premolar space. First aligner, and the 51 aligner, getting better, but we need more move back on the posterior teeth. 9 months, I place a mini screw, so I wanna do using the class 1 elastic for the anchorage control. 31 aligner, only 13 months. She still have a overjet here, but molar relationship is getting better. Now 15 months, much better. Yeah, now it's almost class 1. I'll do the refinement. Now it's a 23 months. The overjet is not bad, and then the space is okay. So I doesn't move the closer space in the lower posterior teeth. So I do a place implant. So 2 months after, I do make the provisional crown. So now she has a proper overbite overjet and class 1 left side, class 1 right side, everything is fine. So now she's gonna almost finish up the treatment. So in this kind of severe case, you can treat. Your treatment plan is good, and then you can do a braces or you can do a clear aligner treatment like that. This is the last cases. Yeah, 1 minute. Every dentist said I met that they don't know how to treat me. What should I do? Because she has a very asymmetric face. As you know, it's asymmetric, but something this problem. A little bit class 3. And then she has the dentinogenesis imperfecta. So all the habitual occlusion like that. And then this is a CR position. But she is only 23 years old. She doesn't have a tooth. So nobody can treat her. So how can you this patient? But this is difficult, but you can do. Everyone can do treat like that. Because first of all, we have to decide the vertical dimension of occlusion. So everything is the problem. So I do mounting on the CR position. So I extract this tooth, and then this one is after that the CR position is getting better, but the problem is the same. So now I determine the vertical dimension of occlusion with the two-jaw surgery. So I discuss with the oral surgeon. Then I decided where the tooth position is there, where the low facial height is there. We discussed a couple of times. And then 2 weeks after surgery, because patient had the clear aligner, the surgery case is very good because the oral hygiene is much better. So now she has the overbite overjet, but now she needs the braces. How can you put the braces, this tooth? You can't do it. We cannot. So I make the provisional crown, there, and the lower, some tooth, and then she needs the mastication function, so I put the temporary crown here, and then what? You cannot put the bracket. We do a clear aligner system. So I move some tooth in the lip positioning of the tooth position, 33 aligners. And then she wear the more 19 aligners. Now it's almost finished up. So she bite is okay. So her vertical is okay. CR position is okay. So I place implant. And then 4 months after, I treat her crowns. So I make the provisional crown. Class 1 occlusion. Face is changing. And then 2 months after, I finish up all the crowns with the zirconia. So after that, she's gonna extract this tooth to place implant. But anyway, now everything is done. She is very happy. She has good occlusal plane and occlusal scheme and good smile line. Everything is changing. So she has now optimal occlusion, harmonious jaw relationship, and easy and efficient oral care, and then she has in mind the self-confidence and self-esteem, and then patient has a quality of life is, incredibly increased. It says this is a priceless value. So this is the ultimate treatment. Only dentist you can do this kind of treatment with your treatment goal. So that's why every dentist, even the orthodontist, it doesn't care. We need the interdisciplinary dental treatment planning is very important for you and for your patient. Thank you very much for your kind attention. Thank you very much.
Thank you for